Good morning, good evening. Dr. Pam here. How are you? I hope you're doing fine. Today, my video is about one of the struggles for our young people, teens or young adults. And this usually is a struggle for female who sometimes have issues with their menses or menstruation, which usually is irregular. And sometimes they have hair, on their faces, on their chins. They also, most of these teens are usually obese. And this condition is called Polycystic Ovary Syndrome. Mostly people in healthcare, they call it PCOS. And sometimes the teens don't know. They are struggling, around the teen age is when they are struggling with their identity. They are struggling to, fit in. And then you find that the obesity already is putting them in a place where they feel stressed out. And then when they find that they cannot have regular periods, it also puts them in the stress and usually they struggle with that. And that is why today I'm talking about PCOS or polycystic ovary syndrome. One of the characteristics of polycystic ovary syndrome is where that the anovulation, where they usually don't ovulate as well. Infertility, especially for young adults who want to start their family. Excessive production of male or hormones, so that puts them into obese. That's why usually you find they have like midweight obese. They are in the middle. They're obese in the middle, meaning they have a little extra meat in the middle. Most of the time they also are insulin resistance. So these young adults, usually they complain about, or you can actually see facial hair, you can see very bad acne, they have acne on their faces. Some might have periods, but the periods are not consistent. They might see periods in 3 months, and after 3 months they might not see the periods, or they will not see periods in a very long time. So amenorrhea, meaning they are not seeing periods as a regular person sees periods every month. A regular teenager or a regular woman sees their periods or their menses every month. So you find that they have that. And when they have that, they also have thick hair. The faces, the hair that comes in their face is thick. So usually when your doctor, you are supposed to see your gynecologist. As a parent, if they're teenagers or they're young adults who can go by themselves, they need to be seen by their gynecologist who specializes in women health. They will check them. They will do tests, to check their hormone levels. Usually they will do an ultrasound, and they usually find that their ovaries are enlarged. That is why most of them don't get pregnant. You also find sometimes the follicle stimulating hormone in them. Usually you find it is either normal or it is a little bit low than the normal people. When they check their fasting blood sugar, you find that it is abnormal. Some of them might have diabetes, some might not have diabetes. So what can be done for this kind of adults? Usually they are given low dose of contraceptives to suppress the enlargement of the ovaries. They are also given some medication, sometimes blood pressure medication. They are also given Provera tablets, to help to help induce the menses, meaning to help for them to start seeing their periods regularly. Sometimes they are given glucovage or metformin. It's the same thing. They are given so that it is used also to induce ovulation, so that they can ovulate. So if you are a young adult and your gynecologist puts you on metformin or glucovage, you need to be very careful because you can get pregnant at that time. So you need, if you are sexually active, you need to use another form of contraceptive so that you don't get pregnant. Also, it helps if you lose weight, because if you lose weight, that also helps, or that also supports. Other things that you have to be aware of if you know that you have this polycystic ovary syndrome, you need to be aware that you be checked by your cardiologist because it can affect your heart. You also need to be checked by endocrinologist or your regular doctor. Let them check and make sure that you don't have diabetes, because this group of people tend to develop diabetes. It is not always, but they tend to develop diabetes. Also be checked for breast cancer or endometrium cancer. So be checked, and also be aware that due to this condition, you might not conceive or get pregnant as easy as a regular person. So infertility is also indicated in this group of people. So with polycystic ovarian syndrome, when you see your teenager, they are developing, strange hair on their face, on their chins, too much acne. I know normally teens develop acne, but too much acne, and they have all these other symptoms, and they are very obese, they are heavy, middle weight heavy. Just take them to your doctor, let them be checked, and let them see if they need to be helped. Sometimes at this time, teenagers and young adults, they are struggling with other issues. If you can take them to your doctor, you can take them to a gynecologist, that will ease their problems, because sometimes they are struggling with identity. This is one problem that if it's taken care of, they know that they are not strange. They know that they don't look different than other adults or than other teenagers. This will help them. Sometimes the doctor will explain to them in nicely so that they can understand what they are going through. So I hope this video is going to help your teenager or your young adult to understand if they have all these symptoms, they should be seen by their gynecologist or their doctor so that they can help them. I hope you understand. I hope you subscribe to my YouTube channel, Dr. Pam Obare Mogaka, and also you can share this. Thank you and be blessed.